7 silent signs of type 2 diabetes in women you should never ignore. Imagine your body sending you warning signals, and without realizing it, you're ignoring them all. It may sound shocking, but that's exactly how type 2 diabetes works. It doesn't appear with a big alarm. It creeps in silently with symptoms that often go unnoticed. That's why you cannot underestimate these signs. Today, I'm going to show you 7 silent signs many women overlook, which could be warning you that something's wrong. Before we go on, make sure to subscribe to the channel and turn on notifications so you don't miss anything. And if you stay until the end of this video, you'll know exactly which signs to watch out for to take action in time and prevent complications. These signs may seem subtle, but they can make all the difference to your health. Ready to discover what they are? Diabetic neuropathy is, without a doubt, one of the most silent and dangerous symptoms of type 2 diabetes. This issue arises when blood sugar levels stay elevated for long periods, damaging peripheral nerves, especially in the extremities like the hands and feet. You know that uncomfortable tingling sensation we all feel sometimes when we stay in the same position for too long? Now, imagine feeling that constantly, without any clear reason. And what's worse, over time, that sensation can turn into numbness, meaning small injuries might go unnoticed. For example, a woman might step on something sharp without feeling any pain, simply because her foot sensitivity is compromised. This greatly increases the risk of wounds, infections, and serious complications like foot ulcers. In everyday life, this loss of sensation can affect simple activities like walking, holding objects, or even tying your shoes. Someone who used to walk long distances might start noticing that they trip more often or that their feet feel heavy. This is a clear sign that something is wrong, but it's often ignored until the condition has progressed. Unfortunately, many women, especially those who don't know they have type 2 diabetes, attribute these symptoms to other causes, such as fatigue or aging. That's why it's crucial to pay attention to these subtle changes, which may be your body's way of asking for help. Keeping your feet healthy is essential for anyone showing these diabetes symptoms. A practical tip: create a daily routine to inspect your feet, checking for cuts, blisters, or any skin changes. Plus, visiting a podiatrist regularly can help detect issues before they become serious. For those already experiencing numbness, wearing comfortable, protective shoes is essential to prevent small accidents from becoming more severe. And it's not just about your feet. Your hands can also be affected, making even tasks like writing or holding a cup of coffee challenging. Speaking of visible physical signs, let's now dive into something that's easily noticed by people with type 2 diabetes: skin changes. The skin is the largest organ of the body, and interestingly, one of the first to reflect when something's wrong inside. In the case of type 2 diabetes, skin changes are quite common and often go unnoticed. Dark patches, especially in areas like the neck, armpits, or skin folds, are signs of diabetes that shouldn't be ignored. These patches, called acanthosis nigricans, are a reflection of imbalanced blood sugar levels. Imagine someone noticing these dark patches, but thinking it's just a cosmetic issue. The truth is, they're a strong indicator that something more serious is happening. In addition to dark patches, there's also diabetic dermopathy, which presents as small, scaly spots, usually on the legs. These can be mistaken for allergies or common skin problems, but in reality, they are another symptom of diabetes. This is something that requires attention because, if left untreated, it can evolve into more complex issues. For women, who often pay close attention to their skin, noticing these changes can be the first step toward seeking help and a diagnosis. This shows how important it is to have a keen eye on the signals your body gives, especially on something as visible as the skin. Keeping your skin healthy can be simple but effective. Staying hydrated and using specific creams can help minimize the impact of these skin changes. For those dealing with these signs, seeing a dermatologist regularly is essential, as they can determine whether these patches are just superficial or related to diabetes. Prevention is key here. Caring for your skin early on and not ignoring even the smallest sign can prevent future complications. And since we're talking about physical changes, there's something even more impactful that's often underestimated: unexplained weight loss. Unexplained weight loss is one of the most alarming signs of type 2 diabetes and often goes unnoticed or even celebrated, especially by women trying to lose weight. However, this sudden weight loss, without any conscious changes to diet or exercise, could be a major sign that the body is struggling to use glucose as an energy source. When this happens, the body turns to burning fat and even muscle, which leads to rapid weight loss. The problem is, without proper treatment, this process can continue until a person finds themselves in a constant state of weakness and fatigue. Imagine a woman who, without changing her eating habits, starts noticing that her clothes are looser. Initially, she might think she's finally losing weight, but in reality, this could be a symptom of diabetes, not a positive result. Unexplained weight loss needs to be carefully monitored, especially if accompanied by other diabetes symptoms like excessive thirst or blurred vision. If you're enjoying this so far, don't forget to subscribe and leave a like to keep getting valuable information about how to take care of your health. And feel free to comment. Have you noticed any unexplained changes in your weight? Share your experience with us. To reverse this situation, it's crucial to regulate blood sugar levels as soon as possible, preventing the body from continuing to lose weight in a harmful way. Maintaining a balanced diet and regularly checking glucose levels are important steps for anyone noticing this unexpected weight loss. Ongoing medical follow-up can also help identify if this weight loss is linked to insulin resistance or other conditions that may be emerging. However, it's not just weight that can change in someone living with type 2 diabetes. There are other signs that may seem minor but are equally important, like yeast infections. Yeast infections are a common annoyance for women, but in the case of type 2 diabetes, this problem becomes even more frequent and intense. This happens because high blood sugar levels create an ideal environment for yeast growth, especially in intimate areas. Women dealing with diabetes often experience repeated episodes of yeast infections, which can cause a lot of discomfort. The elevated glucose in vaginal secretions serves as food for these fungi, making the problem persist and, in many cases, worsen. It's important to remember that this situation doesn't have to be seen as inevitable. There are ways to prevent these infections, such as closely managing blood sugar levels and maintaining proper hygiene in the most affected areas. A practical tip is to choose cotton underwear, which allows the skin to breathe, reducing moisture and, consequently, the growth of yeast. Also, for those already dealing with recurring infections, it's essential to seek medical treatment to prevent the issue from becoming chronic. If you're enjoying this so far and have ever dealt with yeast infections, comment below on how you usually handle the situation. And don't forget to subscribe to the channel and leave your like for more health tips. Maintaining these simple habits can prevent bigger complications in the future. And speaking of complications, another common issue among women with type 2 diabetes is the increase in urinary tract infections. Let's dive deeper into this in the next section. Urinary tract infections are another recurring issue for women with type 2 diabetes. The high concentration of sugar in the blood, and consequently in the urine, creates an ideal environment for bacteria to grow in the bladder and urinary tract. The result? Frequent infections that are often hard to treat, causing pain and discomfort during urination. For those living with diabetes, urinary infections are not only more common, but can also escalate quickly, leading to complications such as kidney infections. This is yet another sign that the body is struggling to control blood sugar levels properly. The link between type 2 diabetes and urinary infections can be seen in the fact that the immune system weakens when blood sugar is high. This makes it harder for the body to fight off bacteria, leaving women more vulnerable to these infections. If you're noticing symptoms like pain while urinating or the feeling that your bladder is never fully empty, it might be time to investigate further. Women with diabetes need to pay attention to these signs because early diagnosis and treatment can prevent the problem from becoming more serious. If you've found the content useful so far, be sure to like the video and comment below. Have you ever had a urinary tract infection? How do you usually deal with these symptoms? Your experiences can help others going through the same issues. And if you haven't subscribed to the channel yet, now's the perfect time. Now, turning back to women's health, let's talk about a condition that affects many women and has a direct link to type 2 diabetes. Polycystic ovary syndrome, PCOS. Polycystic ovary syndrome, PCOS, is a condition that affects many women, and what few people know is that there's a direct link between PCOS and type 2 diabetes. Women with PCOS often have insulin resistance, meaning their bodies have trouble using insulin effectively. This raises blood sugar levels and over time can lead to type 2 diabetes. Additionally, excess insulin stimulates the production of male hormones, like testosterone, which causes symptoms such as irregular menstrual cycles, weight gain, and the appearance of ovarian cysts. For many women, being diagnosed with PCOS can be a wake-up call to double down on health, especially in terms of diabetes prevention. It's important to adopt a balanced diet and exercise regularly, as these habits help improve insulin sensitivity. Regular medical checkups are also crucial, as they can prevent the progression of both PCOS and type 2 diabetes. Women dealing with these conditions know that lifestyle changes make a huge difference in managing symptoms. If you're enjoying the content so far, comment below what you think about the link between PCOS and diabetes. Have you heard about this connection before? Don't forget to like the video and subscribe to the channel for more valuable health tips. It's always good to remember that, while PCOS can present challenges, it's possible to live a good life with the right care. And now that we've covered these points, let's recap the most important signs of type 2 diabetes in women. Excessive hunger, also known as polyphagia, is another silent and often underestimated sign of type 2 diabetes in women. This intense, ongoing hunger, even after regular meals, is caused by the fact that, despite glucose being present in the blood, the body can't use it effectively due to insulin resistance. This means that the body's cells are starving for energy, even though glucose is circulating. In response, the brain signals that more food is needed, leading to an insatiable appetite. For a woman who's constantly hungry, it can be easy to dismiss this symptom, attributing it to a busy day, PMS, or other everyday reasons. But when this hunger persists, even after eating, it could be a sign of something more serious. For instance, many women end up eating more without realizing that the issue is the body's inefficient use of glucose, not the lack of food. Over time, this situation can worsen, leading to potential weight imbalances and complications associated with type 2 diabetes. If you've noticed that your hunger is out of control, it's important to pay attention to the other signs we've discussed. Sometimes it's the combination of small symptoms that reveals the bigger picture. If you've experienced something like this, comment below and share your story. And of course, don't forget to subscribe to the channel and leave a like so you can keep getting information that will help you take better care of your health. Now, with all these signs revealed, it's clear how the body tries to warn us about the presence of type 2 diabetes. Now that you know the 7 silent signs of type 2 diabetes, it's time to start paying closer attention to your health. These small signs could be the beginning of something bigger, but with conscious choices, you can prevent complications and live a more balanced life. Your body deserves this care, and the good news is that you can start now. Your health is in your hands. And if you're wondering where to start, I recommend watching our previous video. Alert: 15 foods that help control diabetes quickly. In that video, you'll discover which foods can help you control blood sugar levels and avoid these issues in a practical and fast way. Don't miss this chance to learn how to take even better care of your health. Comment below. Which of the 7 signs will you be more aware of from now on? And of course, don't forget to subscribe to the channel and turn on notifications to keep receiving content that can transform your life.